Good morning everyone, welcome to the report of the World Epidemic HIV/AIDS. I'm Hevi Nurhayati from Semarang State University, Sport Science Faculty majoring of Public Health. In this opportunity, I would like to tell you about HIV/AIDS. So, what is HIV/AIDS? HIV or Human Immunodeficiency Virus is a virus that attacks the body immune system. Over time, the immune system begins to fail, which is called immunodeficiency. It increases the risk of infection and tumors. But HIV medicine can slow or prevent progression of the disease. There is currently no effective cure. Once people get HIV, they have it for life, but with proper medical care, HIV can be controlled. If HIV is not treated, it can lead to AIDS or Acquired Immunodeficiency syndrome. AIDS is the late stage of HIV infection that occurs when the body immune system is badly damaged because of the virus. There are two types of HIV. HIV-1, which causes almost all cases of AIDS worldwide. HIV-2, which causes an AIDS-like illness. HIV-2 infection is uncommon in North America. So, what are the symptoms? HIV may not cause a symptom early on. People who do have symptoms may mistake them for the flu or mono. Common early symptoms include fever, sore throat, headaches, muscle aches, and joint pain, etc. The early symptoms usually go away within 2 until 3 weeks. After a certain point, symptoms reappear and then remain after many years. Their symptoms usually include swollen limb, nose, extreme tiredness, weight loss, fever, night sweat, etc. So now we move on the stage of HIV/AIDS. So, with knowing your HIV status help you make a healthy decision to prevent getting or transmitting HIV. HIV is typically through 3 stages, including stage 1, acute HIV infection. Some people have flu-like a symptom as a body infection, but some people may not feel sick right away or at all. If you have flu-like a symptom, ask for a test to diagnose acute infection. Only antigen or antibody or nucleic acid test can diagnose acute infection. Stage 2. Chronic HIV infection. This stage is also called asymptomatic HIV infection or clinical latency. People may not have any symptom or get sick during the phase without taking HIV medicine. This period may last a decade or longer, but some may progress faster. People can transmit HIV in this phase. At the end of the phase, the amount of HIV in the blood goes up and the CD4 count goes down. The person may have symptoms as the virus level increases in the body and the person moves into stage 3. Stage 3 is Acquired Immunodeficiency syndrome or AIDS. The most severe phase of the HIV infection. People with AIDS have such badly damaged immune system that they get an increasing number of severe illness called opportunistic infection. People receive an AIDS diagnosis when their CD4 cell count drops below 200 cells per millimeter, or if they develop certain opportunistic infection. People with AIDS can have a high viral load and be very infection without treatment. People with AIDS typically survive about 3 years. So how the viruses can be transmitted? The virus is not transmitted from touching, kissing, through food, insect bites, or in the pool. It's transmitted through unprotected sex, drugs addict, blood transfusion, pregnancy, non-sterile instrument. As a public health worker, we must have initiative to end the HIV/AIDS epidemic in the world by supporting in HIV prevention, diagnosis, treatment, and outbreak response. That is all the report today. Thank you.